And we're recording.
Buenas tardes. We're here for a commissioner's session this afternoon. Today is August 18th, 2025, and we're here to have a discussion. Colorado building a response to federal changes impacting the Latino community. Si nos acompaña en persona para esa reunión, contamos con interpretación disponible en la sala. Acá atrás nuestros intérpretes están sentadas. Por favor, diríjense al fondo para recoger y retirar sus audífonos. Si nos acompaña por Zoom, encontrará en la pantalla instrucciones sobre cómo acceder al canal de interpretación, ya sea desde su teléfono o computadora. Si está usando su teléfono, deberá utilizar la aplicación de Zoom, hacer clic en Más y luego en Interpretación de idiomas. Si está en su computadora, deberá hacer clic en el icono de globo terráqueo en la parte inferior derecha de su pantalla. Le recordamos que si se conecta a Zoom por llamada telefónica, la interpretación no está disponible. Tratamos de ofrecer la opción de trabajar, participar, escuchar en el idioma del corazón. Thank you to the interpreters that are here so that we can allow folks to participate in the language of their heart. And if you see somebody join us a little bit later and you would like to offer them the services, let's just be friendly and graceful for folks. So let's see here. Just a quick note in regards to decorum. We're in a public meeting, which is a limited public forum. While members of the public are welcome to join in person and online, this meeting is not open for public comments. It just means we won't have discourse between our participants and my esteemed colleagues here at the dais. The dialogue this evening will be limited to our panelists. It is inappropriate to cheer, boo, hiss, talk, or applaud, or otherwise disrupt the meeting. Members of the public are not expected to agree on all issues, but must make an effort to respect the process, and we're thankful. So let's get started here. I want to thank the incredible panelists who have joined us today. And I won't do introductions for each of them, but they will have an opportunity in their initial speaking points to talk to us about the work that they're doing. We're joined today by Abby Ocampo Abby Ocampo, I'm so sorry, Ocampo, Sister Cardamon, and then Carla Colin with the Latino Chamber is on the way. Jorge de Santiago, thank you, El Centro Amistad. Our Vice-Consul, Barbara Chumil, from the Consulado General de Guatemala is here with us. Jessica Herrera, Green Latinos, is participating with us today. Thank you. Kelly Daughtery with Clinica Family Health and Wellness, is here. And then Laura Zavala with the National Association of Hispanic Real Estate Professionals, Government Affairs Director for the Northern Colorado chapter. Thank you. And Mike Cortez from the Colorado Latino Leadership Advocacy and Research Organization, also known as CLARO. So we appreciate you all being here. I also want to say thank you to Boulder County staff support to bring this meeting together, and specifically our policy team for helping prepare a quick turnaround. And the reason that we had a quick turnaround, just to be clear, is that Colorado, amongst other states around the country, announced special sessions for a variety of different reasons, and that is happening this week here in Colorado, starting Thursday morning. And so that is the opportunity that we have met time with. This meeting is presented as an opportunity for our local, state, and federal elected officials to listen and learn about the impacts that our Latino community is feeling and confronting in a variety of issues, with the ask for elected officials to advocate for policies and legislation that will benefit and prioritize several areas. As one elected official in local Boulder County government who identifies as a Latina, I realize that leadership and organizations in different offices around our region may not have the same data, stories, or experiences to include in the extremely important work done as elected officials. First, I'd like to share some statistics about who the Latino community is in Colorado, statewide and in Boulder County, when we start contemplating the immense power of such a large percentage of our residents. More than 48,000 Latinos live in Boulder County. Depends whose data you use and what numbers you look at, but about 14% of people in Boulder County identify as Latinos. And almost 1.3 million Latinos live in Colorado. Approximately 10% of people in Boulder County were born outside of the United States. And immigrants contribute more than $21 billion in spending power to the Colorado economy. And we're going to hear some more data points from our amazing speakers as we continue. I'm so grateful to the experts who've joined me today, as I've already gotten a chance just to mention a few names, to give their knowledge and experience, share data and resources around the critical topics of housing, access to healthcare, small business, basic needs, climate, and mental health, just to name a few. This afternoon, I'm asking each speaker to introduce themselves by sharing not just a name and organization title, but with a little bit of data, examples or stories about the service area or sector that you each are working in, to help us understand what impacts are occurring and the risk if we don't work together for solutions now. My esteemed colleagues who are sitting with us will then have an opportunity to share some discussion amongst ourselves. Perhaps we'll focus on an overlapping solution in the conversation. Again, we're not answering questions of the audience today, but we are asking elected officials and community leaders, organizational leaders to listen, consider, contemplate, and be ready to take away some action for you and your team, whether you represent a faith group, policy organization, classroom, or other. So let's begin our learnings together. And I think what we're going to do is maybe we'll start on this end, only because Carla was driving in, so I know she's going to be running up the stairs, so that way we'll give her an opportunity to join us. And what I'm going to do, you've all got the points in regards to your introduction, so I'm just going to give you about 5 minutes each. And so if you see me making a motion, it just means your time is about to be up. We do have a card in the front. So there'll be a little sign that comes up that says you have a minute left, just to help you. Speakers, when it's your turn to speak, just get the microphone close to you. You'll be able to move the microphone because it does need to be right by your mouth, not just for hearing in the room, but also for the archiving. So we're going to start with Mike Cortez.
Thank you very much. Thanks for the invitation to join you today. I'm Mike Cortez. I serve as president and CEO of the Colorado Latino Leadership Advocacy and Research Organization, which is such a long name. That's why we call it Claro instead. If people have been around for a while, you may remember us as La Raza, the Latin American Research and Service Agency. We are a 61-year-old nonprofit, nonpartisan organization based in Denver. As other organizations have developed up around us, we become more specialized. So we are primarily a public policy, advocacy, research, and leadership development organization now. We work a lot at the state capitol, and our mission is primarily to help Latinos have more influence over decision makers in government at all levels of government that affect Latino families and communities. So our sector is kind of broadly defined. We are a growing population. The last census counted basically 22.5% of Colorado as being Latino. We had big problems with census undercounts the last time around. My best estimate is that we're just about 1 out of every 4 Coloradans now. If you want to know what our future looks like, that's you can see it in our school classrooms. On average in Colorado, 1 out of 3 students in public school are Latino. We're concerned very much about what's coming out of Washington, D.C., and the somewhat related physical constraints being imposed on, for a variety of reasons, on state and local government. But the primary impetus of our concern is Washington and very much the so-called Big Beautiful Bill, or H.R. 1, that has just been signed into law. The effects on Latinos that we're most concerned about are effects that will affect immigrants, but will mostly affect U.S. citizens who are Latino. We're very concerned about impacts on health, housing, basic needs, small businesses. Medicaid is the big issue that has us most concerned. We have friends and neighbors who depend on Medicaid funding for access to health care, and that's going to be severely constrained. Much of the effects of that will happen after the 2026 congressional elections. And so I'm very anxious to get the word out about what's going to be happening in 2026, 27, and 28 as a result of this new legislation. We're very concerned about reduction in supplemental nutrition assistance programs, or SNAP, what we used to call food stamps. An awful lot of our neighbors are depend on that for assistance for nutrition for their families, and that's being cut. Those of us who have dreams of our children going to college depend a lot on Pell Grants. Those are being cut. That makes college accessible to more people who are less affluent, and that's a program that's being cut back. Health insurance premiums for everybody else who's not on Medicaid are forecast to go up very significantly as a result of several changes made to federal law as a result of this bill. And then the increase in ICE enforcement is of great concern. We have to remember that 79% of Latinos in Colorado, according to census data, are US-born US citizens. But they're likely to be affected by immigration enforcement, in addition to people who have papers to be here, and especially mixed status families who are very much at risk. So these are all concerns that are going to be troublesome, in our view, in the next 3 to 5 years. And I'm looking forward to helping to get the word out prior to the elections. Thank you very much.
Thank you for the input. Really appreciate you being here. Laura Zavala?
Hi, good afternoon, everybody. I'm here speaking as the Government Affairs Director for NARIP, the National Association of Hispanic Real Estate Professionals. We are a purpose-driven organization, and we do this through three pillars: educating and empowering the real estate industry, advocating for public policy, and also facilitating relationships among our industry stakeholders, such as the real estate practitioners and other industry professionals. There are 4 pillars that in this year NARIP is focusing on, and that is housing affordability, access to credit, industry best practices, and macroeconomic issues. The way that this administration is having an impact on the homeownership side is, as of May 25th of this year, individuals that hold an EAD card, an employment authorization document, such as your DACA, your TPS, your BAGUA, anybody that is here lawfully, legally trying to buy a house can no longer purchase a home using FHA loans or USDA loans. This is having a tremendous impact in our industry, as we will see that now homes are sitting longer on the market because we have pulled out of a participating market individuals that were qualified and ready to buy. And I'll give you an example. Just a couple months ago, I had an I-10 family that was purchasing a home. And what should have been, Jesus Christ, what should have been something that should have been exciting for both families, one selling, one buying. It was heartbreaking because the seller was an I-10 family that had just purchased their home 5 months ago. They went to court following procedures, and they were told that they had to auto-deport themselves and sell their home because now they knew where they lived. So this family that had dreamed of becoming a homeowner just after 5 months of owning their home, had to sell their home and auto-deport themselves. This is what my industry is seeing. This is how homeowners are becoming affected. So I am asking for our legislators to please help us support with this administration and change this law that began as of May 25th of this year.
Thank you, Laura. And we'll have some time for additional conversation and examples about the housing industry. We'll move to Kelly Daugherty.
Thank you. Good evening, and thank you for having me tonight. My name is Kelly Daugherty. I'm the Executive Vice President of Health Center Operations at Clinica Family Health and Wellness. Clinica is the safety net provider in Boulder County. As a reminder, Clinica Family Health and Mental Health Partners completed a nonprofit merger in October 2024. We provide integrated medical, dental, and behavioral health primary care services through clinics in Nederland, Gilpin County, here in Boulder, Lafayette, plus 3 clinics in Adams County. We have dental hygienists in the Boulder Valley School District. Additionally, we offer outpatient and specialty behavioral health services, addiction and recovery services, and crisis mental health services at clinics in Boulder, Longmont, Lafayette, and Broomfield. At Clinica, over 71%, or about 38,000 of our primary care medical, integrated behavioral health, and dental patients, and over 21% of our specialty behavioral health clients identify as Hispanic or Latina. The majority of our medical, dental, and integrated behavioral health staff are bilingual in both English and Spanish, and we offer real-time language assistance across all of our locations and services. Research shows that proportionally, persons who identify as Hispanic or Latina fare worse in many health measures and report higher proportions of fair or poor health. At Clinica, we're tracking several major negative implications of recent federal actions on our patients and communities, including our local Hispanic and Latina community. Colorado had the nation's most severe drop in Medicaid disenrollment following the end of the COVID-19 public health emergency. As a result, most of our patients who have lost Medicaid have become uninsured. They are still our patients and still require care and services. The rise in uninsured has been absorbed by safety net providers like Clinica and Salud at significant financial strain to our nonprofit organizations. This has already resulted in reductions in staffing and services. Now, we face new threats of major additional drops in Medicaid coverage. Many of the cuts to Medicaid that are part of the federal OBBBA will impact direct revenue to Clinica in coming years. And this will be true for our community hospitals and other safety net providers. Medicaid reimbursement is the largest source of revenue for safety net health providers. I cannot emphasize that enough. The federal cuts will have direct impact on the amount of funding that will come to the county. All data suggests these federal cuts will result in higher levels of uninsured people, which will further strain existing services with more uncompensated care. Additionally, there's a very immediate impact of reductions in federal subsidies to individuals purchasing health insurance on the exchange market. Insurance premiums are anticipated to go up by over 30%. Coupling this with reductions in subsidies, this means that individuals purchasing individual insurance plans could be paying at least 50% more for their coverage. In Colorado, the state has developed the OmniSalud insurance plan, which is a way for undocumented Coloradans to safely compare health insurance plans and enroll through a secure online platform. Last year, the 12,000 available enrollment slots filled in less than 24 hours. This year, it is anticipated that less than 3,000 slots might be available. Medicaid cuts will strain the state of Colorado's budget and system, as there is no viable path to replace those funds with existing state funds. This means that in addition to federal cuts, the state will likely need to make its own further cuts to Medicaid, further exacerbating the financial pressures on our safety net providers. Beyond these coverage and financial impacts, we are also carefully tracking the potential impact of federal executive orders. In particular, the U.S. Department of Health and Human Services, HHS, announced on July 10th that it has formally rescinded a 1998 interpretation of the Personal Responsibility and Work Opportunity Reconciliation Act of 1996. Effectively, this change is intended to, and in the words of HHS, ban illegal aliens from accessing its taxpayer-funded programs. It has implications for programs like health center and mental health center funding, as well as Head Start and others. We are tracking the legal analysis, challenge, and interpretation of this order very carefully, but it is yet another threat to the programs and services that many of our community members rely upon. Thank you for your time.
Thank you, Kelly. Jessica?
Thank you. Good afternoon. My name is Jessica Herrera. I serve as in-house counsel for Green Latinos. Green Latinos is a nationwide nonprofit organization advancing environmental justice for the Latino community. We believe that environmental justice policy isn't just about protecting the planet. It's about protecting people, in particular people of color, Latino communities, and low-income populations that are disproportionately impacted by pollution. Environmental policies have real, tangible impacts on Latino communities. Latino neighborhoods are more likely to be located near highways and other industrial zones. This means that families live with poor air quality, which drives higher rates of asthma, heart disease, and other chronic illnesses. To give an example, a few weeks ago, I was in Commerce City, which is home to the most polluted zip code in the entire nation. Commerce City faces pollution from the Suncor refinery, industrial buildings, and heavy truck traffic. CDOT, the Colorado Department of Transportation, has put forth a proposal to expand I-270, which runs through Commerce City. And under federal law, they are required to consider alternative proposals. Green Latinos hired engineers and other professionals to come and analyze the landscape. And we held a town hall meeting where we heard from the concerns of local community members. We heard from one mom that stated that her child was diagnosed with obstructive sleep apnea at a very young age because the air quality was so bad. Commerce City has a large Latino population, about 48.9% according to the latest census. So while CDOT is concerned about how to expand the highway to get more trucks on the road so that industry can make more money, low income and people of color are paying the cost with negative impacts to their health. Commerce City isn't unique. Across Colorado, Latino families are paying the price of pollution with their health. These are not abstract harms, they are lived realities. So some of the other unintended consequences, if not addressed, are health disparities, especially for children and the elderly. Families also will face greater financial strain, more inhalers, more ER visits, more hospital bills. And we are also actually learning about how air pollution affects children. Studies have linked living near industrial activity with learning disabilities, which means that a child's zip code can actually not only just affect their health, but also their ability to succeed in school and could be contributing to school to prison pipelines. The stakes are not abstract, they are measured in life expectancies and quality of life. So that's the depressing news. The good news is that we know the solution. Invest in renewable energy and clean transportation. These investments cut pollution, they reduce energy bills, and they create local jobs. But right now, federal rollbacks are halting that process. The EPA recently announced that it intends to terminate all 60 grants under the $7 billion Solar for All program. Colorado alone was set to be awarded $156 million of that to launch a statewide program that could have lowered household electricity bills by 20%, which equates to about $400 a year for families. Solar for All would have broken down a historical barrier. Clean energy has often only really benefited wealthier homeowners. Many Latino families rent homes or they live in multi-family units, which usually blocks access to rooftop solar. And then more broadly speaking, the president's budget bill has cut over $500 billion in environmental climate cuts. There have been cuts to clean energy, rollbacks for EV charging, tax credits, more program rescissions, funding for air quality, and cuts to community resilience programs. So in closing, I just wanted to say that Latino communities deserve not only to survive, but to thrive, and that requires local governments to step in during times when federal environmental policies don't protect the health, advance equity, and make renewable energy accessible to all. Thank you.
Thank you, Jessica. And next we'll hear from our Vice Consul, Chumel.
Thank you for having us in this important space to share and discuss the meaning of our communities here in Colorado. We are located in Denver. We are covered the Wyoming and Utah states. For continue with my aportation, I will continue in Spanish. En relación a los aspectos que hemos observado, hemos visto un incremento de solicitudes de asistencia a nuestra comunidad que ha sido en muchas ocasiones retenida por autoridades como es ICE, ¿verdad? Esto ha generado una demanda bastante grande y hemos visto un incremento desde el 2024 al 2025 de un 18% en el tema de asistencia y protección en nuestro consulado, donde hemos requerido de parte de nuestra comunidad orientación legal, migratoria y apoyo social de una u otra manera, ¿verdad? Hemos visto también a familias en situaciones de vulnerabilidad que desconocen acerca de recursos que puedan ser proporcionados.
Permíteme un segundito porque vamos a hacer una interpretación aquí. No sé si las intérpretes ahí atrás pueden ayudar. O si no, yo puedo intentar.
So one of the things that we have observed is an increased attack in our communities, especially by authorities. For example, ICE. Generally, an increase that has happened from 2024 and that have come for protection to our consulate, requiring legal help, social services, families that are vulnerable and don't know that there are resources available.
También como parte de las consecuencias, hemos visto que nuestra comunidad ha atravesado desafíos bastante grandes en el tema de obtener recursos o de alguna u otra manera sus derechos sean sido válidos durante sus procesos migratorios. Hemos tenido conocimiento de que hay familias que han sido separadas y es una de las cosas más relevantes que hemos podido observar en este año y que también importa mucho para el consulado, ¿verdad?
So one of the consequences for our community, and that has been a great challenge, is for these families being able to obtain resources, especially validating their rights, the process of immigration, families being separated, and also one of the other relevant things that are important to us as a consulate.
Y me gustaría poderles ejemplificar uno de los casos que nuestra comunidad ha atravesado. Es una que sucedió acá en el estado de Colorado. Era una familia de esposo y esposa que habían migrado a este país para obtener una mejor oportunidad económica debido a que su hijo se encontraba, o se encuentra más bien, con una leucemia avanzada y el padre es el único que tiene es el sustento de la casa, ¿verdad?
And I would like to give you an example of what our community is going through. And one of them is from here in Colorado, a family, a husband and a wife who immigrated here for the economic opportunity as one of their sons has advanced leukemia. And the father is the only, he is the main income breadwinner.
Y este ejemplo lo traigo a la mesa porque muchas de las familias latinas y en especial las guatemaltecas migran a este país por una situación económica que deben mejorar. Nuestro país se encuentra trabajando en mejoras constantemente, sin embargo, estamos en ese progreso, ¿verdad? Como una comunidad latina que sigue creciendo y pudiendo obtener mejores oportunidades para nuestro país. Sin embargo, la lucha es constante y aún seguimos trabajando en eso. Esa es una de las principales razones porque nuestra comunidad migra y se ve en la necesidad de afrontar estas situaciones.
And I bring this to the table because a lot of our Guatemalan families migrate for economic situations. As a country, we are working towards that and being able to have a betterment in our own country. And it's a work in progress, and we are growing. But we also fight to be able to make a better situation of that and to continue to thrive.
Y para finalizar, solo quisiera agregar, el Consulado de Guatemala está dispuesto y está en toda la disposición de seguir colaborando con las autoridades locales, con nuestras autoridades federales a nivel nacional, ¿verdad? A través de nuestra embajada en Washington. Seguimos trabajando porque las familias no sean separadas. Y si las familias guatemaltecas se ven afectadas por esta situación, también seguir como un rastreo de todos los niños guatemaltecos para saber dónde se encuentran ubicados. Y esa es una de nuestras como mayores preocupaciones, ¿verdad? Saber dónde están nuestros niños, con quiénes están, si estos niños están siendo bien cuidados o no. Obviamente el cuidado de un padre o una madre nunca va a ser reemplazado, ¿verdad? Pero también nosotros tenemos que velar por los derechos de nuestros niños. Gracias.
Muchas gracias.
And we also add, that as the Consulate of Guatemala, we are available and, willing to continue to work with the authorities, the local and at the national level, along with our embassy in Washington, that if our families should find themselves separated and are affected, that we are able to be there for them. But also to be able to track our Guatemalan kids, which is our biggest worry. To figure out with who they are, if they are being taken care of or not. Of course, the care of mom and dad will never be able to be replaced, but it is our job to also watch over the rights of our children.
Muchas gracias, Vicecónsul, por estar aquí con nosotros. Thank you so much to our Vice at the Consulate, General Consulate of Guatemala for participating with us today. Next, we have Jorge de Santiago from El Centro Amistad.
Gracias, Marta. Buenas tardes, good afternoon. My name is Jorge de Santiago. I'm the co-director of El Centro Amistad, a nonprofit organization who was founded back in 2001 for the need to really have a place for immigrants to, learn about their rights. Since then, we have changing and we have deal with situations like this right now. Immigration has been on top of the list for our communities since I've been here since 1987. So this is not new for our communities, but this is, I think, the level of intimidation and the level of hunting that they do into our communities is incredible. It's sad to see that, and this is how, from the federal government coming down, how this is impacting our communities right now. Thank you.
Vicecónsul.
Vicecónsul, por la información que nos dio. You know, I want to take that specifically about the separation of families, something that we have seen over and over in this country. This is inhumane and is something that is really affecting our communities in terms of mental health. In our organization, we do work in health equity, access to services and programs for communities. But one of the core areas that we have been focusing in the last couple of years since the pandemic has been mental health and trauma. You know, this situation right now has been increasing the trauma and re-traumatize our communities by really attacking directly and hunting our communities. And this is coming down across the country. And in Boulder County, it's not exception. You know, we have been providing mental health support for our communities since the pandemic. And I will say, since the new administration took over, I think the need for services, mental health, has increased over 60%. Since the beginning of the year, we have increased the sessions for families. I just saw the last note from, and we have provided over close to 700 sessions, individual sessions, to our communities. That's something that really reflects compared to last year. Our community was getting the support, but not reaching out because they were like, okay, this is therapy, we managing our stress. No, this is really impacting the whole family now. And I'm taking that separation of families because we've seen the impact going down all the way to the children. Right now, the biggest concern that we have as an organization, I think we should have that concern as a community, is really the impact that is happening in children in our communities. These immigrant children, they're not performing well at school. They suffer trauma and re-traumatization in their families. And just by seeing and talking to these children, their experience they already have coming to this country, I mean, you will be traumatized by those stories. I think the most crucial thing that I will say that is happening, that is already happening in our community, that I'm really proud of Boulder County, is the collaboration efforts that we have. I think part of the success that our communities have access to mental health has been the collaboration with other nonprofits and other clinics. You know, we have referrals from EFA, from Clinica, from Boulder Valley School District, you know, from different entities in our communities. And that says that mental health is on top of the priorities in our community. Yes, we can tag, everything is going away, funding is going away. But how can we make sure that our communities have what they take to really balance their emotions, to control and really address the trauma that they're dealing with, and really saying how we can help those families with children and make sure those children have a better future in our communities. This is something that we have to work towards that, and we have to find solutions. I think in Boulder County, we have the advantage and we have great leadership that really seeing that it listens to the community. This is the perfect example, really setting that for us and our communities to really put information to you. Thank you.
Thank you, Jorge, for being here. And next we have Carla Colin with the Latino Chamber, Boulder County.
Thank you. Hello, everyone. My name is Carla Colin. I'm the president of the Latino Chamber, and the Latino Chamber of Commerce promotes economic development, growth, and sustainability for its member by enabling access to business opportunities and development resources through strategic initiatives. And I want to echo what everyone has said here, because when we think about businesses, and specifically when we think about underserved businesses and businesses that don't have the privileges that the big corporations have, we think about all the issues that everyone has talked about here. Housing is a big thing for us, and health and mental health and all of the separation of families. But another thing that worries me a lot, and why I'm here trying to share with all of you, is the support that we are not going to have as nonprofits when we serve these underserved communities. It's going to be very difficult for our community leaders to feel comfortable helping communities when we don't have the budget, when we don't have the capacity, and when we are being persecuted for supporting underserved and underrepresented communities. That's going to be a big issue for a lot of us, especially those of us that don't have a citizenship or have a DACA status or a work permit, when we don't feel comfortable showing up in public and defending our communities, because we are gonna feel persecuted as well. So that's gonna be a big thing for our communities and a big impact. If we start losing these community leaders that are supporting the underserved communities, it's gonna be a disaster, because no one else is gonna do all the job, or no one else is gonna continue the great work because of the knowledge of the community. Many community members that are supporting communities that are vulnerable are community members that have gone through those struggles already and that understand our communities. And it's gonna be really hard to find people that have the knowledge and the culture to make it happen and to keep working with them. I also wanna mention that with changing on programs and adjustments to the SBA, access to capital and programming for small businesses, it's also a big struggle for small business owners as well. Government contracting has decreased a lot on our communities because they're afraid on working with the government, even if it's state or at the county or municipality level, because they're afraid of making contracts when they don't have a social security number, even when their business is paying taxes and they have a federal number to do their taxes, because they're afraid to be persecuted for not having a social on their own. And I also want to bring workforce and labor laws. It has come to our attention at the chamber that there are business out there with people that may or may not have the documents to work or have a business, but they're losing employees, so they cannot continue. And I just want to give a quick example. We have a cleaning business here in Boulder County that is making over $250,000 in profit, and they are afraid to stay because the owner has not a social security numbers, neither their employees, and they're working as contractors and subcontractors. And even when they're doing everything legally and as better as they can, they're afraid to lose that business because they've had 20% of their employees going back to their countries because they're afraid of being here, staying here, and getting caught by ICE and not having the opportunity to even pick up their children from school. So I just want to share that because everything that everyone has said before impacts small businesses, because at the end is how families try to survive and stay in the country when they're being persecuted. Thank you.
Thank you, Carla, for that insight and input. I appreciate you. And next, we're going to go to, and I'm so sorry, Abby Campo. I don't know why I keep thinking Ocampo. It's Abby Campo. Thank you for joining us.
Thank you, Marta, for having me here, and thank you for everyone sharing. My name is Abby Ocampo Sapien. I am here with Sister Carmen Community Center. I'm a bilingual advocate supervisor. Sister Carmen was founded in 1976, and we provide assistance to the residents of Lafayette, Louisville, Superior, and Erie who are in need, and we serve without discrimination. I have seen a lot of shifts in the past 8 months. Just to break it down for you, in January of 2025, we had 2,582 participants access our food bank. In February, 2,459. In March, 2,364. In April, 2,266. In May, 2,132. In June, 2,324. And surprisingly, in July, 2,400 participants. But you can see the shift from January to May, how many of those participants stopped accessing our food bank. And when we look at the data, I can see the names of those participants, and they are Latino participants. There are 182 participants that are still missing, quote unquote, from our food bank. So what's happening to these people? Are they being picked up by ICE? Are they afraid and not coming to our food bank? We want to serve everybody in our community, and unfortunately, those people are afraid. I have heard stories about people not wanting to come to our food bank because they're afraid of getting picked up by ICE on their way to get something that's essential to our bodies. I've heard people who no longer want to leave their homes because they're afraid that their children will come home to an empty house or they won't be there to pick up their children. There's been talk about removing my population from the census. So that means loss of political representation, reduction of funding for vital programming, inaccurate data and planning, and these communities become invisible. We become invisible to this nation. You know, the cost of living is ridiculous in our country. 42,000 people in Boulder County live under the poverty line, and a family of four on average makes about $2,084 or $89. The cost of living is $6,000. So if people are accessing our food bank, they're spending more money on these essentials or not eating. They're reducing their food intake. Children are hungry, families are hungry, and these families already have the stress of being persecuted, and then they have to worry about, how am I going to bring food to the table? I have had single mothers who have stopped working because they can't afford childcare, or they've been asked to stop working because they can't provide documentation. And then because of all of these funding cuts, I have to tell people that I can't help them because I no longer have rental assistance for them. Our food bank also has experienced some cuts. So all around, I have to tell people, no, I can't help you with rent. I can't help you with utility assistance. I'm sorry, because we have faced cuts in our community center. And people get left behind. People go hungry, people lose their homes. And unfortunately, our state is landlord friendly, so people are getting evicted. And Sister Carmen is not able to prevent evictions, where one small community organization that is helping people, but we cannot solve the problem. And I just would like to share this information with you so you know how all of these things that are happening in our country are affecting not only our regular population, but more specifically our Latino population. Thank you.
Thank you, Abby, for being here. Thank you to each one of you for being here, for participating, and for sharing. Together, I feel like our task right now and our opportunity is to inform decision makers, government and otherwise, to advocate, to write policies, to create processes that center our Hispanic, Latina, Latino communities that are being targeted by the federal administration. I was recently in a community meeting where a person shared their experience of being harassed by a neighbor, specific to their race, specific to the color of their skin, specific to the language that was being heard. And it was a long process for them to get legal support, even though that neighbor was trespassing, looking in their windows, and threatening them. That's an example recently here in Boulder County. Our own county vehicles, as we sit in a local Boulder County government organization, some of our own department vehicles have been misperceived as federal authorities and have created fear here in Boulder County. These are also examples that are local. I want to give you all, as panelists, an opportunity to reflect on anything you heard or ask questions, maybe of curiosities or ideas about how your experiences and the work that you're doing may intersect or may overlap. And so if you want to just give a signal of a hand if you'd like to speak, you'd be welcome to do that. And we have about 20 minutes for us to just have some dialogue, and then we'll have a last question for each of you to make a final ask. Jorge.
Yeah, I think to me, I think this opportunity is really to really create new systems because the systems we have currently don't work. I put an example, the COVID pandemic. During COVID, I think everybody remembers, to the vaccination campaign, we have several communities who were not don't want to get vaccinated because they didn't trust the government. So we were able to create with Rocky Mountain Equality, Marty and Amistad, what we call with public health and other county authorities in the Clinica, we came together to really talk about how can we create access to our community so people feel safe here. So we created what we call it equity clinics, where our staff for Amistad and Rocky Mountain Equality, we were there welcoming our communities to come. So similar like that could be something like this. Conversations have been happening since the beginning of the year, probably since last year. You remember, we've been having these conversations, but I think it's an opportunity. Thinking that we don't have much time to really create those systems. And I just want to mention, when we talk about the pandemic, it took us 4 months on meetings to create those clinics. So our communities got behind 4 months to get vaccinated. Several of those individuals died because they didn't have access to the vaccine on time. Several of those individuals got sick, lost their jobs and everything. So the impact for our communities is coming since then. So with this new administration, this is even worse. So what can we do here? I think instead of really looking at the problems, how can we create those solutions? And I think we have a great, talented people around us in our community, elected officials who really are willing to listen and receive the recommendations from our communities, because I think we're not the experts. We're just facilitating what we hear from our communities here. I think this space needs to be available for our communities too, but unfortunately, they won't feel safe to come and speak in front of you. So sometimes for me, it's hard to come and speak in front of you because I don't know who I'm gonna be dealing with. But guess what? I have to do it because the privilege that I have, and I think our community need their voices too. And I think we have an opportunity here again. I said, we already collaborating somehow. I think we just need to tie those knots with some legislators, some elected officials, some new system we can create, new models, they're already there, and see how can we create a welcoming, safe community for all, not just for all immigrant community, but I think for all. I think it's important to really address that we have to take the bureaucratic process to the side and really get to work and put those systems, whatever is out there, put it on the side, because that really limits us to really accomplish what we want to do for our communities.
Thank you. I hear that systems change maybe, and creating access for all. Thank you. Laura?
I just want to share a couple of statistics. Here in Colorado, Hispanics represent 54% of homeowners. More than 30% of DACA recipients represent homeowners across the country. And more than 60% of Latino households have mixed status, where you might have an I-10 borrower, undocumented, a resident, a US citizen, and somebody going through their immigration process. I don't think this administration is going to care about our emotional stories. So when I was in Washington, D.C., advocating for this very same change about non-U.S. citizens being able to apply with FHA loans or USDA loans, my question to our legislators was, what is going to get through their ears? Because it's not emotion. We know that. He didn't stop going after our farm workers because he felt sorry for the stories. He stopped because these billionaire farm owners went to him and said, this is hurting our pockets. So I think we need to create these roundtables and come up with economic statistics of how this is hurting the state of Colorado. How is this hurting our businesses money-wise? Because I believe that this is the only way that we are going to see any change happening. It's not going to be through emotion. We know that.
Thank you, Laura. Mike?
The billionaire farm owners might be a good example for us. They can make a difference in elections. They can make a difference in reaching out with their resources to legislators. given our numbers in Colorado, we don't have to be powerless. It's going to be tough because many of our organizations are losing funding at the time that our clients are getting cut off from benefits. But it is possible without spending a lot of money to become more of a policy advocate. There's a lot of misinformation about what nonprofit 501c3 agencies are allowed to do, but nonpartisan lobbying is allowed if you know the rules. There's a few things we can do. One, we can cooperate with each other in forming coalitions in different legislative districts when we're trying to persuade somebody at the state capitol. We can get used to getting to know our fellow nonprofits better and creating coalitions for advocacy. At the federal level, where it's much more difficult, it's still possible to at least encourage people to vote. We've got the 2026 midterm elections coming up. It's, for most of us that are 501c3s, it's against the law for us to suggest how people should vote, but we can bring issues to their attention. And getting the information that we're hearing today out to folks who are able to vote and tell them what's beginning to happen now and what's going to continue to happen in 2026, 2027, and 2028 as a result of the legislation that we're talking about now is hopefully giving people a reason to go out and use their own heads about who they're going to vote for in the midterm elections. So midterm elections for federal policy, forming coalitions here in Colorado for state policy, these are within our reach, and they don't require a great deal of resources, unlike a lot of the services that we provide.
Thank you. I heard some ideas here around voter registration and different ways to advocate. And Laura, you mentioned creating roundtables to be able to share that economic statistic. Yes, Abby?
Mike, I think you bring a good point about being a 501c3 and not, telling people what to vote or not to vote on. And Sister Carmen has done a really good job about engaging with voter registration, just registering people and letting them know that it's something that they can do. I always say that a lot of people think that voting is a right, but it's actually a privilege because we have communities of color that can't vote, like our undocumented community or people that have been to prison. So I think it's, even though we can't tell people what to vote or not to vote on, I think the voter registration piece is very important because we can get our allies then to vote for the issues or have these communities that sometimes don't want to vote to get them engaged, because some of the time they're people that care about us and our community. So thank you for bringing that up.
Thank you. Any other comments right now in dialogue? And it's okay if not, we can keep moving.
I think we all have call to action items.
Yeah, I think everyone's ready for the next question, so we'll keep moving here. And first of all, hang on a second, I'm so sorry, I was going back into my other notes. I think we've got an opportunity, as Jorge said too, just in regards to the collective work, and I'm going to be very interested in kind of what other asks might be as we move forward. So before we finish out, I do want to share a message. I met with one of our consuls from Mexico last week who was hoping to be here and their schedule didn't permit, but the Consulate General of Mexico in Denver did send a message, and their message, the Consulate General of Mexico in Denver works to protect and defend the rights and interests of Mexican nationals in Colorado, Wyoming, and Montana. We provide assistance and guidance in cases of detention, immigration proceedings, accidents, medical emergencies, deaths, disappearances, human trafficking, domestic violence, and any situation of vulnerability. We also offer guidance on consular procedures and services, including passports, consular IDs, civil registry services, powers of attorney, and documentation for Mexicans abroad. Our commitment is to stand by your side during the most important moments and the most difficult situations. And they asked to pass on this information because, of course, we're being live streamed as well. For emergencies, call the Information and Assistance Center for Mexicans, which is SIAM, at 520-623-7874, or the consulate's emergency phone, which is 303-667-8657. We are at your service to assist, guide, and support you. And we appreciate the consul for sharing important information as well. So I want to, a couple different pieces. In closing, I'm really hopeful that our leadership teams in Boulder County, elected officials at all levels, and our organization partners will consider and take actions on the suggestions that we've heard and some of the ideas that might be stemming for folks. As I spent the last week talking with folks about this convening, it felt like the beginning of a conversation. And I do believe there's an opportunity to consider collective action. So I'm going to go back to the panelists, and we'll start on this side this time. And what I've asked the panelists to do is share, after their preparation, after our conversations, and after being here at the dais together. I'm going to give you each a minute, and we're going to be kind of sticklers on the time, to respond to the following question. What is the one action or an ask that you would like elected officials to take and or hear today? And we'll start with you, Abby.
It's been very difficult after the big, beautiful bill passed, with all the cuts, especially because of the work that I do. But my ask is to think about the families and the community that's being affected. I ask you to be conscientious about your constituents. I also ask you to advocate to fund vital programs and to not cut money from organizations that are helping to bridge the gap about this hurtful rhetoric happening in DC. And my biggest ask is to please stand for those that are the most vulnerable. Thank you.
Thank you. Carla?
If I have to make a summary of only one ask, would be to please keep in mind the nonprofit organizations and the people supporting the vulnerable communities. And I think one of the biggest things that I keep thinking over and over time, especially in the last 6 to 8 months, is what would happen if us as nonprofits wouldn't exist, or if we didn't have the funding to exist. What would happen if Amistad, El Comité, Sister Carmen, or the Latino Chamber wouldn't be here? What's gonna happen next, and who is gonna support those communities? So think about that, please. Thank you.
Thank you. Jorge?
For me, I'm asking officials to expand access to health and mental health services for all families in our community, regardless of immigration status, and to invest in culturally grounded, community-based programs that addresses the trauma caused by the current immigration climate. Latino families should not have to choose between safety and seeking care. By ensuring equitable access to healthcare and supporting organizations like Amistad, El Comité, Clínica, and everyone else, you can help break cycles of fear, strain trust, and build a healthier, more resilient Boulder County for everyone. Thank you.
Thank you. Vice Consul?
My specific request is to strengthen coordination between our offices, local and state authorities, and the consulates to ensure the individuals and vulnerable situation, particularly those in detention, have timeless access to accurate information about their rights and the available sources to their own language. With more agile communication channels, we can address cases more efficiently, reduce uncertainties for families, and contribute to overall stability and well-being for the Latino community as well.
Thank you. Jessica?
My ask to every elected official here today is, Can you commit to touring one of Colorado's overburdened industrial areas before the end of 2025? See firsthand who is being impacted and ask yourselves, is it affluent communities or is it low-income Latino families and people of color? Because every rollback isn't just a policy change. It's more ER visits, more inhalers, and more hospital bills. Latino families deserve clean air, clean water, and a future where our health is not determined by our zip code. Thank you.
Thank you. Kelly?
As I've listened to all the comments today, I keep thinking about something that's in statute for community health centers that requires us to see all people regardless of an ability to pay. As I think about the stories that have been shared, I'm going a little bit off of my prepared notes here. It's hard not to have an emotional response to it. We know these stories are true. They're not necessarily surprising, although they're just hard to hear every time to hear them. A large majority of the patients we care for at Clinica Family Health and Wellness identify as Hispanic, Latina, Latino. Policies and actions that continue to lead to decreased funding for access to physical, dental, and mental health care in our communities, whether as part of budget decisions or part of policy changes about the definitions of who is eligible for care, will not only lead to reduced services at organizations like Clinica, but it will also lead to increasing costs throughout the entire healthcare system through uncompensated care and people presenting for care when they are really sick. We ask that everyone understand the gravity of and the impact of the anticipated funding cuts so that every effort can be made at the local, state, and federal level to protect funding for safety net providers. I also hope, and today my intention has been here to use my voice as a white male, experiencing the privileges of our society, to speak up in allyship today on behalf of these issues, to raise awareness and a call to action to support our Hispanic Latina community and other marginalized people in our community.
Thank you, Kelly. Laura?
I'm asking legislators to work with this administration and speak about the numbers, speak about the statistics, and how not allowing non-US citizen or permanent residents to be able to, non-US citizens to be able to apply for USDA FHA loans. This has pulled qualified participant homeowners that were ready to buy, and you have now pulled them out of the market, and this is affecting ultimately the sellers. Their homes are sitting longer on the market. It is affecting everybody's pocket, and I'm asking our legislators to work with this administration by providing numbers and facts because that's what they care about.
Thank you, Laura. Mike?
I'm going to imagine that I have a legislator sitting here in front of me from the state capitol. And the first thing I'm going to do is to thank them for having passed Senate Bill 276, which used state law to help push ICE back in their federal law enforcement. And those are some creative statutes. Good job, but we're going to need them again. There's a Supreme Court decision in the next few years that I'm going to worry about that could hurt immigrants. There are some new enforcement ideas coming out of the administration that I think will require some new state legal protections to help block. So I would ask the legislature to be on the lookout for the need for more helpful state law, new state statutes, and to be able to listen to folks like we're hearing today about the need to prioritize those who are most in need of health care and other forms of assistance. It's a good time for them to show up and continue to be helpful.
Thank you. Appreciate each of you being really clear about what an ask could be and an invitation, the way I heard it, for local, state, and federal folks to be working on behalf of our Latino community in Boulder County and the state of Colorado. I want to share just a small piece of the reason we're here today and a little bit of the context. I have had the great opportunity in the last 11 weeks to do a couple different things as a county commissioner on behalf of Boulder County and on behalf of all of the residents. One was to participate in Elected Academy with Latinos Represent, which is national elected officials who all represent as Latinas or who all identify as Latinas. And we spent 9 weeks together really talking about what needs to be done from school boards to councils to state reps and to federal work. And so that is my belief about that we can do work in new ways, and it will demand us to unify in ways that we haven't previously. The second opportunity that I took, and appreciate my staff for the support for me and my fellow commissioners for the support for me to be able to have participated with the National Association of Latino Elected Officials just 3 weeks ago, NALEO. And the conversations were similar to this, all of these different impacts and what that really means. And so I'm going to share with you a section of a book called Weathering: The Extraordinary Stress of Ordinary Life in an Unjust Society. And this is documenting the previous rates that our current administration, when they had an initial opportunity to lead this country, took. And what it says is our immigration policies and the militarized enforcement of those policies exacerbate the effects of this prejudice on Latinx in the US, compromising their freedom of movement, their ability to participate fully in the society around them, and their feelings of safety. This may contribute to cumulative health burden for immigrant and US-born Latinx alike. And I share that because I appreciate each one of you who are here with me on the dais today, taking the risk to be here to share the important truths. And so my ask for elected officials is believe us. Help us advocate for this significant sector of Colorado, because we are not just an economic number, but we understand, and I believe we can say that collectively from the conversations that we've each had together, that this country is in an awful situation where morals and ethics and values have been thrown to the wayside when people of color are being targeted, racially profiled, removed, not given access to a legal process that does exist. And so my belief is that when we connect all of those impacts of housing and climate and healthcare and access to healthcare and insurance premiums that touch all types of insurance, we have an opportunity not just for the variety of members of our Latino community in our diverse backgrounds, but an opportunity for all of us to then, as they say, the boat rises together or something similar to that. So I do want to thank you each for your time and the energy and the effort to come to the city of Boulder and be with us today. My hope for this discussion is that it asks of our elected officials and decision makers around Boulder County and the state of Colorado to allow us to be heard, and that folks will take additional steps to address concerns that will help us all. The work ahead is of unity. When we consider needs of one group of folks, my belief is that Latinos are one specific target of the federal administration, as we've heard in a variety of ways, but it doesn't stop there. We have an opportunity to do intersectional work. The same way we worked collectively to bring you all information about housing and small business and legal process and voter registration, access to healthcare, the impacts of census, and other topics. I would like to ask you all who are here in the room to join me in a round of applause for our panelists and our gratitude to each of you. Again, I do want to thank the other elected officials that are here in the room and online today. And our ask is for you to take this information back to your councils and your trustees and your school boards and other areas that you all work in. We're going to conclude our conversation. There is time until 6:30 for folks and panelists to visit or share resources. We do have refreshments for you. I'm going to ask each of the panelists and folks who are directly impacted, who are sitting in the room, to just take care of yourselves. And maybe grab a glass of water and know that you do not have to speak for all of the entire Latino community, And I really am appreciative of what you've given of yourselves today to be here, be in the room, and for all of you who have spoken. And if folks do want to connect with the panelists, and anybody who has to leave, business is done, and you're welcome to carry on with your life and your business and all of the quehaceres que hay que hacer. Thank you so much. Thank you.